My name is Hafifa. So today I will introduce about muscular dystrophy. What is muscular dystrophy? Muscular dystrophy is a genetic disorder that gradually weakens the body muscle. It caused by incorrect or missing genetic information that prevent the body from making the protein needed to build and maintain healthy muscle. There are 30 types of muscular dystrophy. In some types of muscle problems start when the person is very young. Muscle, primarily voluntary muscle, become progressively weaker. The different type of muscular dystrophy affect different set of muscle and result in different degree of muscle weakness. There are no cure for muscular dystrophy, but medication and therapy can slow the course of the disease. So here are some characteristics of muscular dystrophy, such as enlarged calf muscle, restriction of joint motion, scoliosis, difficulty breathing, heart problem, and early death.
There were some cases were reported among people around the world.
First one is a Michael Clinham, who is 35 years old, that suffered Becker muscular dystrophy. Becker muscular dystrophy is a form of muscular dystrophy, a genetic disorder that gradually makes the body's muscle weaker and smaller. Michael explained that he spent all of his time advocating for the disease as well as raising awareness of muscular dystrophy. Second one is Scott Parley, who is 40 years old and lives in the Fredericton, New Brunswick with his family. Scott, who has Duchenne muscular dystrophy, has been used ventilator for 7 years. Duchenne muscular dystrophy, or DMD, is the most common of the muscular dystrophy, affecting approximately 1 in every 3,500 newborn boys. It is caused by a fault in a gene called dystrophy, or DMD gene.
And the last one is
Errol Abraham, who is suffered limb girdle muscular dystrophy, and symptoms appear at age 5. Limb girdle muscular dystrophy affects the muscle of the upper arms, upper leg, shoulder, and hips. For the past 6 years, Carol has been coordinating Limb Girdle Muscular Dystrophy Awareness Day, which is recognized worldwide.
Hi, I'm Karina. Now we will continue on to the next topic, which is type of muscular dystrophy. As we all already know, there are more than 30 other types of muscular dystrophy that are caused by genetic mutations. But which types of muscular dystrophy that is most common? The most common type of muscular dystrophy is myotonic muscular dystrophy. This disease is most common in adults and it affects both males and females. The signs of the disease normally begin in adulthood, typically in 20s or 30s, but it can also appear at any age. The disease may be further classified into two types, which is type 1 and type 2. People with this disease have a decreased life expectancy. The next one is Duchenne muscular dystrophy. This type of disease is most common in children and it affects only males. The symptoms usually appear at the age between 2 until 6. Persons with Duchenne mostly need a wheelchair by the age of 12 because of the progression of the disease and usually have a short life. Becker muscular dystrophy is also the most common type. It is similar to Duchenne, but the disease is much milder and it affects only males. The sign typically appears between the age of 2 and 16, but can also appear late at the age of 25. People who suffer from Becker usually can walk until their 30s, and they also live further into adulthood. Now we are all clear on the types of the disease. Next, we will discuss the signs and symptoms of the muscular dystrophy. The primary symptoms of muscular dystrophy is muscle weakness. Different types of disease will affect different muscles. Progressive muscle weakness in the lower limbs can cause several problems in movement such as standing, walking, and climbing stairs. Other symptoms of muscular dystrophy is Gower sign. Gower sign is a condition where a person needs to use hands on the knees to stand up. This is caused by the muscle weakness in their pelvic. The next one is calf muscle enlargement. This is due to the muscle tissue being replaced with fat and connective tissue. There are also a few other symptoms that are usually shown. For example, unusual walking gait or waddling, frequent falls, heart problems such as heart failure and arrhythmia, scoliosis, breathing problems, and learning disabilities.
Hi, my name is JV Ng and now I'm going to explain about the factor of muscular dystrophy. The factor of muscular dystrophy is gene mutation. What is gene mutation? It is an alteration in the makeup of genes that affect the way it fulfills its intended role or function. When a certain gene that is involved in making proteins that protect muscle fiber is defective, muscular dystrophy will happen. So as you all know, muscular dystrophy has variation and each one of them has different factors that lead to that particular muscular dystrophy. So now I'm going to explain the causes of some of the most common forms of muscular dystrophy, which are Duchenne muscular dystrophy, Becker muscular dystrophy, and myotonic muscular dystrophy. The first one is Duchenne muscular dystrophy. It is an X-linked inherited disease, and it is caused by a deletion of a DNA segment or a single gene defect on the short arm of the X chromosome. X-linked inherited diseases are passed down through families through one of the X chromosomes, and usually the deletion on the DNA segments occurs in women. When this happens, the daughter has a 50% chance of inheriting the changed gene and 50% chance of inheriting the normal genes. Next is Becker muscular dystrophy. This type has the same factor as Duchenne muscular dystrophy but less severe and slower progression. Lastly, myotonic muscular dystrophy. It is an autosomal dominant trait. If you look at the DNA, there is a specific sequence in the DNA that predisposes the person to this type of disease. Myotonic dystrophy is associated with CTG trinucleotide repeat expansion on chromosome 19. So, essentially, if chromosome 19 has a lot of CTG sequence, it will lead to this form of muscular dystrophy, which is myotonic muscular dystrophy.
Assalamualaikum and hi everyone. My name is Zuhilmi Fakri. So now I will explain about diagnosis and treatment for muscular dystrophy. First, I will explain about diagnosis for muscular dystrophy. The doctor will give your child a physical exam and they may do some tests to rule out other conditions that can cause muscle weakness. If the doctor suspects muscular dystrophy, they will do some other tests including blood tests, muscle biopsy, and electromyography. First, blood test. The doctor will take a sample of your child's blood and test it for creatine kinase. Creatine kinase is an enzyme that your muscle release when they are damaged. A high creatine kinase level is a sign that your child could have Duchenne muscular dystrophy. Second, muscle biopsy. Using a needle, the doctor will remove a tiny piece of your child's muscle. They will look at it under a microscope to check for low level of dystrophin. Dystrophin is the protein that is missing in people with Duchenne muscular dystrophy. Third, electromyography. An electrode needle is inserted into the muscle to be tested. Electrical activity is measured as you relax and as you gently tighten the muscle. Change in the pattern of electrical activity can confirm a muscle disease. Now I will explain about the treatment for muscular dystrophy. There is no cure for this disease, but there are many treatments that can improve symptoms and make life easier for you and your child. First, therapy. Occupational therapists can help patients with muscular dystrophy relearn lost motor skill and learn ways to work around weakened muscle. Speech therapy helps to teach them how to maximize their muscle strength. Second, medication. Medication can help ease symptoms. They include anti-seizure drugs that reduce muscle spasms, NSAIDs, eteplirsen, golodirsen, and vitolarsen for treating Duchenne muscular dystrophy. There are injection medications that help treat individuals with a specific mutation of the genes that leads to Duchenne muscular dystrophy. Third, surgery can help with the different complications of muscular dystrophy like heart problem or troubling swallowing. For instance, people with myotonic muscular dystrophy may need to have a pacemaker installed to treat heart problems, or surgery to remove cataracts, a clouding of the lens, of the eye that block light from entering the eye.